you're doing a lot of thyroid surgery. And what are the different categories?
Oh, sure. Randy, we do a lot of head and neck cancer surgery in general, and I personally do a lot of thyroid and parathyroid surgery. And people wonder, what is the thyroid? Well, it's a gland that controls metabolism. It sits right here, okay, kind of right in front of where your windpipe is. Kind of has a little bridge, and there are two big lobes. So there's a lobe about, so big on each side with a little bridge. And people frequently have their thyroid removed, most often because they have a nodule that was suspicious.
Okay.
I see a lot of people with thyroid nodules. Most of them we fortunately don't wind up operating on. There are a lot of needle biopsies, which are just done with them awake. But for those people that have a suspicious nodule, or if they unfortunately have thyroid cancer, then we'll wind up removing part or all of the thyroid. Occasionally people have what we call hyperthyroidism, where that gland's producing way too much hormone, or there's a nodule that's producing too much hormone, and we have to take and remove the gland for that. So usually, if it's just one lobe of the thyroid, it's outpatient. So they go home the same day. If it winds up being certain kinds of cancers or big cancers, we wind up taking the whole thyroid. Usually that's not done at the first surgery. It can occasionally be. That's done inpatient, with people that stay overnight. But if it's outpatient, they get a small incision. It's about a little finger width above with, their sternal notch, which is a little notch right here in your breastbone. So about a finger breadth, there's a small incision. You go down, find the thyroid, which is actually relatively easy. There are some really delicate structures around that we always localize. One is the nerve that moves the voice box. So we find those. We use actually special techniques. We use a special breathing tube that has nerve monitors on it. So they'll have this special breathing tube, and it helps us monitor the little nerves of the voice box while we find the lobes of the thyroid. There are two little glands called parathyroid glands. They're about as big as like half a chickpea. They're right behind the thyroid. They have the same blood supply as the thyroid. That's a different type of surgery we do, where there's a problem with those parathyroid glands. But for the thyroid surgery, we'll find those. If the parathyroid glands are outside of the thyroid gland, which they usually are, we leave those where they are, take out the thyroid. People go home. It's actually not a painful operation, surprisingly, even though you have an incision on the neck. Most people complain more about the breathing tube and having a bad sore throat from that. They're upset they can't drink orange juice for a few days. Surgical recovery, they're usually off for a few days. They'll take and usually be back to work activities within about 5 to 7 days, sometimes sooner. We ask them not to do any vigorous activity or heavy lifting for about 2 weeks. But yeah, so that's thyroid surgery.